I cover several different areas. So I was most interested in things that had to do with education. I was interested in some of the newer attempts to increase outpatient neurology at various institutions. And when I went yesterday to the session, there were some really great posters about ideas about how to improve student engagement in outpatient neurology and reach out to those who are not interested in going into neurology, but need to know a lot in family medicine, psychiatry, or general medicine. So those were, I think, for those educators among you, I would certainly take a look at those. There's some very good ideas about newly designed courses. You can also see some things in the education room about how further to teach the neurologic exam, give people confidence in clinical reasoning skills, things like that. And then moving to the realm of other general things that I'm interested in. Let's start with the general group. I see this meeting as a place where general neurologists need to get together and defend themselves against the notion that people need to know more and more and more about less and less and less, as ours is a highly variegated subspecialty. And so the general neurologists get together, and I went to several of those sessions, and need to show that there's a very viable role for general neurologists in an academic, even a very research-oriented academic medical center. There are still those of us who want to see people with undifferentiated complaints, and we need to inspire budding neurologists that this is a viable career combining education, clinical reasoning, and clinical care, and it's a very satisfying place to be. So I would encourage people to look at all of the general neurology offerings, and to be a good general neurologist, you also need to go some of the courses about headache. So take a look at the general headache courses, and to be an inpatient consultant, and this shows my bias towards neuro-oncology, you really need to know about the rapidly changing environment of taking care of people with brain metastases, which is moving to more systemic therapy, with some of the newer trials for primary brain tumors, and perhaps most of all for the rapidly evolving landscape of immunotherapy. So those immunotherapy courses, I think, are really great, and they're going to get you up to date on the medical complications of these, as well as the CNS and PNS complications of these therapies, which are considerable. I find it difficult to imagine that people can go away for a year, come back for their month on the inpatient consult service, and even know the names, of the cancer drugs, much less their interactions. So I would highly recommend that you look at the immunotherapies, and then there's a course on trends in brain tumor therapy, which is high yield as well.